Is it a problem if you do a lot of energy-based facial treatments like radiofrequency under the skin, FaceTite, and then you want to have surgery later, or you do some sort of broad spectrums of fillers, etc., etc.? A dear friend of mine coined a new term for that, and they said these are patients that are suffering from affluentia. They have too much money and they spend a lot of money on facial treatments that are called tweakments or little changes, and they hold what they promise. There are small changes for a short period of time, but the proof is in the pudding, and that means how long does the result last? And this is why they have so many different treatments, because they never last that long. Your face becomes this graveyard of all these different treatments you've had, and don't forget, every treatment has an effect. Some wild fillers can create chronic inflammation that just cakes the tissue together, so doing surgery later will become very difficult. Equally, radiofrequency treatments, they always say they stimulate collagen. Well, stimulation of collagen also happens when the boxer is really bad and they get punched in the face every day, and it's called bruising. And with bruising comes collagen stimulation, but it's a scar tissue. So we have to differentiate what kind of collagen is created, and with all these energy-driven treatments, all we create is just scar tissue that, yes, can stabilize facial structures to some degree, but it stabilizes it because these scars are holding everything in a mostly unanatomical proportion. So when you go in there to do anatomical work, respecting the anatomy and doing a facelift, it becomes very difficult because there's a ton of scar tissue. So go easy on going with all these kind of treatments that promise you everything. These shortcuts are promising, but so far I have not seen one person taking a skateboard to get from London to New York. Sorry.